So under obstructive lung disease, we are done with COPD in last video. Now in this video, we'll be discussing about asthma. So asthma is a chronic inflammatory disorder of the airways. Airways means trachea and bronchus. We are not talking about sinus in this. Sinus was damaged in COPD, but in asthma, we are talking about trachea and bronchus that cause recurrent episodes of wheezing, breathlessness, chest tightness, and cough. Now, as any allergen enters our body, there are cilia present that will trap it and remove it. But in some people, they are hypersensitive. So, as this allergen enters our trachea and bronchi, they suddenly undergo bronchospasm. Their bronchi constricts, and the allergen is not able to go all the way to the alveoli. And it's good, but it's not good for air, because air is also not able to go all the way till alveoli. And as there is bronchoconstriction, it is called asthma attack, and the patient can't breathe. Now this is a normal airway, having a normal lumen, and the lumen is lined by mucosa. And after that there is smooth muscles. And there is enough passage for air to pass. Means air can pass freely. But in asthmatic airway, there is narrowing of this lumen, and because of that, air is not able to pass freely. And the patient has breathlessness. And as any allergen come, this patients of asthma are hypersensitive. So as any allergen come, they'll undergo bronchospasm, and because of that, there will be excess amount of mucus released, and there will be more narrowing and more mucus secretion, leading to blockage of this pathway of this airway, causing asthmatic attack. Now asthma is an episodic disease, means it is reoccurring again and again because of any stimuli, and the patient has paroxysms of dyspnea, means it is reoccurring. The dyspnea is reoccurring. Dyspnea means difficulty in breathing. The other thing is cough. Because of excess amount of mucus secretion, there will be cough and wheezing, because of mucus the patient is not able to breathe properly, and because of that we'll see wheezing. And it is an example of type 1 hypersensitivity. Now moving towards the pathogenesis. As any allergen enters our respiratory tract to the trachea or bronchi, it will first go to the antigen presenting cell, and it will break into pieces. After that, this APC will present it on its surface with the help of MHC, and it will present it to the CD4 T cells, that is the helper T cell, and it will differentiate into Th2 cells, not Th1. They will be differentiated into Th2 cells, and it will release interleukin 3, 4 and 5. But the main one is interleukin 4. Why? Because it will go to the B cell, and this B cell will be differentiated into plasma cells, and this plasma cells will produce antibodies, antibody which is IgE, and this IgE will go to the mast cell and attach on the surface of this mast cell, and because of this attachment there will be degranulation of this mast cell. This was when the allergen was coming for the first time, but if the allergen is coming for the second time, then this all will not occur. The allergen will directly go to the mast cell. But if it is occurring for the first time, if the allergen is coming first time in our body, this all steps will occur. And this mast cell will be differentiated into effector and mammary. Effector will affect on the spot, but mammary are for second exposure. Now this will degranulate, and it will contain histamine, serotonin, leukotrienes, eosinophils, prostaglandins, platelet activating factors, all these things. But the main one is leukotrienes. Why? Because it is responsible for bronchoconstriction. It will go to the bronchus via blood. It has this LT receptors and it will do two things. First thing is it is responsible for secretion of mucus, and the second thing is it is responsible for vasoconstriction. Vasoconstriction means this vasospasm. Now we know that the patient of asthma will have cough with sputum, and when we will take this sputum to secumano-fixative, then we'll see three things under microscope: the Charcot-Leyden crystals, Seriola bodies, and Cushman spirals. This three C's. We'll see three C's. This Charcot-Leyden crystals are needle shaped. You can see this. These are needle shaped. And from where it is coming? It is coming from the eosinophils. Whereas the Seriola bodies, they consist of epithelial cells, because when a person is coughing with force, all the epithelial cells will also be present in his cough. And the third is Cushman spiral. It is the easiest one, spirals, and it is made up of mucus. Simple and easy. Now it was all about sputum. But if someone has asthma for a long time, then his airway will change. There will be some structural changes, and that is called airway remodeling. Here you can see this is a mild asthma patient, but with chronic asthma there is airway remodeling, and there will be thickening of airway wall. There will be fibrosis, increased fibrosis in subbasement membrane. There will also increase submucosal vascularity, and the submucosal glands will increase in size because of excess amount of mucus secretion. They have to secrete excess amount of mucus. So the submucosal glands and the goblet cell metaplasia will be seen. Also the hypertrophy and hyperplasia of bronchial muscle will be seen. This all comes under airway remodeling. But the one thing that will not change is Reed's index, which is 0.4. We saw in previous video that it is 0.4. It is a ratio of submucosal layer, this submucosal layer divided by whole layers. So it will not change. It does not mean that anything will not change, but if this is increasing, this all are increasing, and because of that this submucosal layer divided by whole thickening is increasing. If both are increasing, then the ratio will not change. Now about the types of asthma. There are two, atopic and non-atopic. Atopic is the most common type of asthma, and it is a classical example of type 1 hypersensitivity, which we discussed now. But the non-atopic asthma, it is a respiratory infection due to viruses. And this atopic one usually starts during childhood, whereas non-atopic is seen after an age in adulthood. And it is because of allergy, but it is not because of allergy. It is because of some viral infections. And it runs into family, but does not runs into family. And the skin test is positive, whereas this will be negative. And the serum Ig is specific, but it is non-specific in non-atopic asthma. We are done with this too. Now, these two are common classification, but there are also drug-induced asthma and occupational asthma. Drug-induced means we'll see in pharmacology that aspirin sometimes induce asthma, so it is drug-induced asthma. And occupational asthma, it is because of exposure to any irritant. If someone is getting this exposure again and again, it will lead to asthma. Thanks for watching. Don't forget to like and subscribe and share with your friends.